don't get tunnel vision on lateral ankles. I've unfortunately in the last couple of months had quite a few patients coming in to see me with lateral ankle injuries, and they actually weren't lateral ankle. They were bifurcate ligament, OCDs of the ankle, and that kind of thing. So, quick little overview just on my protocols when I get an acute lateral ankle injury. I actually do cam boot them for 3 weeks, but they're also going to aggressive physical therapy. They're doing strength, balance, all that, taking out of the boot. And I do make them sleep in it because what I found when I had
I'm
them
sorry,
sleep
at
in
what
it keeps
point do
that foot
you
and
do you do
ankle.
the aggressive balance? You said 3 weeks in a cam boot, and then how early are you going to do that aggressive balance?
So I'm actually letting them come out of the boot in that 3 weeks, doing the balance and range of motion outside of the boot during that time frame. So they're only in the boot for walking and sleeping, but they're coming out with physical therapy at that same time. I just found that patients heal in 3 weeks. They do fantastic. I've really not had any issues